My name is Gottlieb. I'm an orthopedic spine surgeon down in Miami, Florida with an office down in Key West, and I treat all afflictions of the spine ranging from the neck all the way down to the low back and the pelvis. One commonly overlooked cause of low back pain is the SI joint or sacroiliac joint. The sacroiliac joint is the joint which connects the spine to the pelvis. It's responsible for transferring forces from the lower extremities down through the pelvis and up into the spine. In most cases, the sacroiliac joint is stable and moves very little. In some cases, it can be the cause of significant low back pain. Sometimes, however, this movement can become excessive or painful. This may often follow traumatic or degenerative conditions, and in those cases, patients will often experience debilitating pain and impairment in function. Common complaints related to SI joint dysfunction include low back pain, often on one side. The pain will sometimes radiate into the hips or into the pelvis, and in some cases all the way down the leg. It can be exacerbated with sitting and standing, and pain can also be made worse with laying on one side. Sacroiliac pain is quite common. Although low back pain is the second most common cause for patients to visit their primary care doctor, the diagnosis is often missed. And up to 15 to 30% of patients with low back pain, the cause may in fact be sacroiliac joint pain. Patients who had prior lumbar fusions are particularly susceptible to sacroiliac joint dysfunction. Up to 40% of patients who have had prior lumbar fusions may have pain emanating from the SI joints. Patients who come into the office with a history consistent with SI joint dysfunction will then undergo a physical examination, which includes numerous provocative tests. If these tests are positive, patients are then sent for a diagnostic injection of local anesthetic and possibly a steroid. If that injection, which is performed into the joint, relieves their pain, the diagnosis of sacroiliac joint dysfunction is assigned. Fortunately, most patients with SI joint dysfunction do quite well with conservative measures. Activity modifications, medications such as non-steroidals, physical therapy, braces, and in some cases, radiofrequency ablation where the nerves around the joint are burned. For patients who fail to respond to conservative measures, I can now offer a minimally invasive solution to sacroiliac joint dysfunction. A 2 to 3 centimeter incision is made, and I'm able to place 3 triangular implants across the sacroiliac joint. This allows me to stabilize the joint with minimal soft tissue disruption. Patients are then able to begin weight bearing shortly after the procedure, and most patients return to normal activities within 6 weeks following the surgery. I've been utilizing the iFuse minimally invasive fixation system since 2013, and now over 25,000 procedures have been performed using this FDA-approved technology. Up to 90% of patients who have undergone the procedure have stated that they would undergo the procedure again.